Jenny.
How many of us college students can afford to miss a week of school? Are we smart enough? Maybe, but maybe not. How many of us can afford to miss a week of work? Not many. In fact, I believe most of us probably live paycheck to paycheck. The swine flu is a highly contagious virus that has the potential to keep us in bed for 7 days. That information alone is enough to make me take precautions to prevent myself from getting the swine flu. How about you? No? Well, I've got plenty more. According to the CDC, H1N1 is a potentially fatal flu causing illness in people. The first detected case in the United States was in April 2009, and it has spread like wildfire. On June 11, 2009, the World Health Organization reported that H1N1 was considered a pandemic, meaning it was worldwide. On October 17, 2009, the World Health Organization reports 414,000 lab-confirmed cases and 5,000 deaths. 29% of all specimens tested in the hospitals have been reported to be positive. That's a 3 in 10 chance. The H1N1 virus is a potentially fatal virus, and it is spreading throughout the world at an alarming rate. First, I'm going to educate you on the swine flu and tell you who is at risk. Next, I'm going to inform you of the symptoms and tell you how it's spread. Last, I will tell you how you can protect yourself. The swine flu is a potentially fatal virus, and everyone is at risk. An influenza is a virus that infects people, birds, and animals. The swine flu normally affects pigs. According to Kei Fukuda, a WHO official, there are many forms of the flu and different varieties which have the ability to exchange genes and mutate, Bloomberg.com. According to the CDC, on October 2009, the virus was named the swine flu after lab tests showed similarities to an influenza that normally occurs in pigs. Further studies have shown, though, that the new virus is quite different. There is 2 genes from viruses in pigs in Europe and Asia, but also bird genes and human genes. This is called a quadruple reassortant virus. Anne Schuott of the CDC respiratory chief states, nearly 90% of all fatalities occur in people under the age of 65. This illustrates that the H1N1 virus is disproportionately affecting the young. Data from 27 states shows that 53% of swine flu patients hospitalized are people under the age of 25, according to WebMD News Health. From August to October, the U.S. reported 4,958 lab-confirmed hospitalizations from the swine flu. The high-risk groups include pregnant women, people with weakened immune systems due to diabetes, MS, heart disease, respiratory failure, HIV, and cancer. Also, children under 5, and especially children under the age of 2. 5 reasons college students are at risk. According to Dr. Philip Tierno, Director of Microbiology and Immunology at NYU, college students have bigger concerns than grades and tuition costs. College students are especially vulnerable to the swine flu because of the amount of students and the time they spend interacting with each other. 5 reasons include sharing bathrooms and dorms, sharing desks and chairs, sharing drinks and beers at parties, eating in the cafeteria and sharing utensils, and we all know many college students date around and are sexually active. This virus is serious and it is killing people. According to P. Elliott of the NY Times, 1,000 people in the U.S. have died, including 100 children. R. Stein of the Washington Post reports 28 pregnant women have died. Now that we know where the swine flu comes from and who is at risk, let's talk about the symptoms and how it is spread. The swine flu has distinct symptoms that we can watch for, and it is extremely contagious. According to D. Noon, symptoms include fever, cough, sore throat, runny nose, runny or stuffy nose, body aches, headaches, fever, and fatigue. If severely sick, vomiting and diarrhea may occur. Some people have respiratory symptoms but no fever. Emergency warning signs in adults include sudden dizziness, confusion, shortness of breath, and chills. Emergency symptoms in children include blue skin, fast breathing, fever with rash, and irritability. The swine flu is spread by coughing, sneezing, and touching contaminated items. The swine flu is not contracted from eating pork or any pork products. The swine flu can be spread from 1 day before symptoms appear up until 7 days after they appear. Now that you are aware of the symptoms and how the swine flu is spread, let's talk about how you can protect yourself. The swine flu is contagious, but you can take steps to protect yourself and your family. According to J.B. Stahl and B. Alper of the Patient Education Reference Center, powered by EBSCOhost, simple steps include: do not share drinks, do not bite your nails, wash your hands frequently, wipe down your desk at work or at school, cover your mouth when you sneeze, discard your tissue in the trash, do not touch your mouth, eyes, or nose, avoid contact with the sick, do not attend swine flu parties, stay home if you're sick. According to the CDC, the swine flu can survive on the surface for from 2 to 8 hours. In order to disinfect, you need to use the proper concentration for the proper amount of time, using alcohol, iodine, bleach, pneumonia, or heat. According to T. Mao of the LA Times, Tamiflu is the primary drug of choice and is taken orally. Relenza is the secondary drug of choice, and it is given in a nasal spray. Unfortunately, these drugs cannot always get deep into the lungs, though, and pneumonia can set in. Recently, a shot was approved, and it is used when both of these two methods, it's used as a last resort. Now that you know the ways to protect yourself, it's up to you to use them. The swine flu is a potentially fatal disease, and it is spreading at an alarming rate. First, I have told you what it is and who is at risk. Next, I have told you the symptoms and how it is spread. Last, I have told you how to protect yourself. How many of us can afford to miss a week of school? How many of us can afford to miss a week of work? Not me. The swine flu is a potentially contagious virus and is spreading quickly. That information alone is enough to make me to take precautions. How about you?